Koutou katoa, welcome to the COVID-19 media update today. Today we have 14 new cases of COVID-19 confirmed by laboratory testing. The locations are Auckland, 5 cases, Northland, 1 case, Canterbury, 1 case, New Plymouth, 2, Waikato, 2, including 1 in Hamilton. We have 1 in Tauranga, 1 in the Coromandel, and 1 in Dunedin. All these cases are in self-isolation, with close contacts being identified, followed up, placed in self-isolation, and then regularly monitored. 11 of these new cases have a history of international travel. 1 is a close contact of a confirmed case, and 2 were at the World Hereford Conference in Queenstown earlier in the month, which had a range of both New Zealand and international delegates. This brings COVID-19 cases in New Zealand to a total of 67. We have 4 probable cases as well. These are cases that have previously been described. However, even though we thought they were COVID-19, laboratory testing was negative, and we are treating them as probable cases. Just over 1,200 laboratory tests were carried out yesterday around the country, and that brings the total number of tests carried out to date to over 6,000. An update on community transmission. There were 2 cases announced yesterday where community transmission could not be ruled out. Our further investigations of these 2 cases have still not identified a firm link to overseas travel. Just for clarity, community transmission is when we cannot confirm exactly where the infection came from. As we investigate these cases further, including close contact tracing, this increases our understanding of what the infection pathway may have been, and we can then communicate with anyone who was a close or casual contact and ensure that appropriate action is taken. We can also then update local communities about events or situations where contact may have occurred. So in both those cases, that work is ongoing. I understand that people in the areas where those 2 cases live will be concerned about the risk of transmission. So I ask you to just, everybody in those regions, continue with good hygiene practice, physical distancing, and seek advice if you have symptoms. Details for each of the cases mentioned today and the tally of confirmed cases will be on the Ministry of Health website as soon as they are finalised, and not long after this media update. An update on the 2 cruise ships, the Ruby Princess and the Celebrity Solstice, which recently visited New Zealand, and both of which had confirmed cases of COVID-19, which were confirmed subsequent to their departure from New Zealand. We are asking any passengers on those 2 ships who left the ships during their stay in New Zealand to self-isolate for 14 days since they last had contact with other ships' passengers, and of course to be aware of symptoms and seek advice if they do develop symptoms. Details of the movements of both ships can be found on our website. And as mentioned yesterday, we are also in direct contact with the New Zealanders who were on board those vessels. Some are still in Australia and have yet to return to New Zealand. The customs officials have the details of those people, and they will be identified at the border. They will be asked to self-isolate along with every other person entering New Zealand now, and to register with Healthline. Coming back to the Hereford Cattle Conference in Queenstown, our public health team is following up delegates to that conference, which was held from the 9th to the 13th of March, and 4 attendees, including 2 New Zealanders, have tested positive for COVID-19. The other 2 are an Australian and someone from Uruguay. Close contacts of those cases are being asked to self-isolate, and other attendees at the conference are now considered as close contacts in a precautionary way, and they have also been contacted and required to self-isolate for 14 days since they were in contact with people who were at that conference. Southern District Health Board is doing the tracking and tracing work on this with support from the Ministry of Health. Just an update then on the alert level. The alert level remains at level 2. You will note from the presentation the Prime Minister made yesterday that as part of alert level 2, we are asking people with pre-existing conditions such as chronic respiratory disease, which might include severe asthma, bronchiectasis or COPD, chronic obstructive pulmonary disease, and people who are immunocompromised, for example, if they are having cancer treatment, to remain at home. A message to the over 70s. We know many of you are fit and healthy and living active lives, but the older we are, the less our immune system is able to fight off this virus and indeed other infections. And we have seen from overseas that older people are at more risk of serious complications. So we are strongly encouraging you, in fact urging you, to be aware of the need to stay at home and not to have contact with others. So please do heed the advice to stay at home. Ask friends and families, particularly children, not to visit. For the meantime, this may mean talking to your family on Skype or some other method.